10 things a dentist should never say to a patient. We're going to be sharing these with you right now. I am Dr. David Matto.
I'm Dr. Richard Matto. We are the Matto brothers and the founders of the Matto Center for Dental Practice Success. We're actually real-life dentists. And for over 30 years, we've been helping our dental colleagues all across North America grow their practices, have more fun in dentistry. We do it through seminars, through writing, through coaching, through new patient programs, all kinds of great things. We're here to help you have a better practice and a better life. And we've been doing it for a long time now.
And we're also known as the Dental Practice Fixers, and we have this channel right here on YouTube. And if you like what you hear today, you think we can help you with some more stuff, give us a subscribe. Button's right down there. It's going to be there the whole time. Give us a subscribe. We've got episodes that come out all the time. We'd love to have you connected to us. So, Rich, let's do 10. How about if we alternate? I start with one, you do two.
Let's do it. 10 things you should never say to a patient, but we hear them all the time, don't we?
All the time. Number one, your last dentist did not do a good job here. So the point is, no matter what you see, and we've all seen horrible work from other dentists, very questionable stuff, never, ever, ever criticize or critique another dentist's work. It's a no-win. It doesn't do you any good. Don't do it.
You can even just say, like, I wasn't there when this treatment was done, but all I can do is tell you what I see here today. Instead of criticizing someone.
Yeah.
Wow.
Take the high road.
We've been in hundreds, thousands of practices, right? And we actually watch dentist treatment plan. Here's something we hear dentists say all the time that you should never say to a patient. And this is just an example. Sir, there's a radiolucency at the apex of the distal root. While they're showing the patient the x-ray, the patient doesn't know how to read it. And what's the patient doing? But they have no idea what you're talking about. Don't speak in dental lingo to a patient. These words that sound so natural to us, even things like crown or composite or periodontal disease, they don't know what you're talking about. I hate to use this phrase, but dumb it down. If a sixth grader can understand it, then a PhD can as well. So make sure your patients understand everything you say. Don't use dental lingo.
Dental lingo. Number three, we hear this all the time also, never say it. Let's watch it. Okay, what are we watching? If you see something going on, if you see decay, if you see caries, if you see a fracture, if you see something breaking down, what are we watching? Is it going to miraculously get better on its own? We've never seen that happen in many, many years of being dentists. Things do not self-correct. Stop watching and start doing.
Good advice. Number 4, things a dentist should never say to a patient. Your treatment will be $14,000. Is this the kind of treatment you like? Yes or no? Wow. Too many dentists take these high-pressure treatment plan presentation cases, and they get a new patient that comes in that thinks they have, or that comes in because they have a little pain, or they think they chipped a tooth, they're overdue for cleaning, and they can't get out of there without somebody ramming a high-pressure treatment plan, all written down on a piece of paper, down their throats. But it takes time. It takes trust. It takes understanding before patients say yes to these large treatment plans. So make sure you take time with the patient. And you don't have to present all this treatment all at once. Do it at a pace that's comfortable for the patient. Because if you go for a yes or no answer right away and they say no, you've got nowhere else to go. So work with the patient. Get them to trust you and really love your office.
And we can share techniques, actually how to do it on future episodes as well. So
Absolutely.
make sure you stick with us. Hit that subscribe button because we have a lot more for you. Number 5, never say this. This won't hurt at all or anything similar to that because you're making a promise. Suppose it does hurt. Then, and so let's face it, sometimes no matter how good you are, something is going to hurt. Oh, you give more anesthetic, but don't make any promises that you're not 100% sure you can't fulfill. Be very, very careful with that, and you'll gain your patient's trust.
Fantastic. Number 6, something to never say in front of a patient or to a patient. This is actually in the category of say it in front of a patient. Darn it, Judy, that's the wrong burr.
And then you throw an Explorer across the room.
To see if it sticks. Hey, it's stuck to the wall. The point is, never critique or criticize or discipline or whatever a team member in front of a patient. It just looks bad. Praise a team member in front of a patient. That's what you should say. But if you have to critique someone, be gentle and do it in private. A patient should never, ever hear anything negative about your practice, including the fact that maybe a team member didn't do exactly what your expectations were. Not in front of a patient.
And that goes with not only in the back, but in the front as well. Anywhere in the practice, make sure you don't do that. Where are we? Number 7. Number 7. You have not been flossing or any other type of reprimand. Again, when you reprimand a patient, there are nice ways of getting the message across. When you reprimand a patient, you think they're going to come back? They're not coming back. Be very careful and very gentle in your approach, please.
Number 8 thing you should never say in front of a patient. Well, I'm just going to have to do a little acting on this one. And again, this is from our experience in being in so many dental practices. Blah, 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 yada, yada, yada. We've seen dentists and dental team members just drone on and on. Dentists have a tendency, like if there's a millisecond of space, they feel like they have to keep talking and talking, go to excruciating, boring detail. Say what you need to say, and that's it. Be confident. Be precise. Say something like, I know what the problem is, and this is how we can fix it for you. Don't drone on and on and on and bore them and lose their attention. And it wastes time, too. We need to practice efficiently.
And we've seen that a lot. We know people that have done that and continue to do that to this day.
God, yeah.
Yeah, don't do it, please. Number 9, here's something never, ever to say to a patient. Can you believe that election? Or Congress never should have passed that bill, or anything else. Okay, look, no matter what your beliefs are, what your feelings are about politics, religion, or anything else controversial, just keep in mind these are your beliefs, and that's totally fine. But chances are, if you start to try to get other people to believe what you believe, 50% of your patient population are going to be turned off. Now, if you're ready to lose 50% of your patients, then go ahead and do that. But stay away from controversial topics, religion, politics. What else? They say never talk about sex, really.
No,
but
or do sex with your patients. Probably not a good idea.
Please be very careful and pick an innocuous topic of conversation.
And there's so many good ones to talk about.
Exactly.
Current events, the boring weather, the music, sports, so many great, their family, so many great things to talk about.
Multi-level marketing. No,
not
that. That should be like number 11.
Right. That'll be the bonus number. Okay. Number 10 thing never to say to a patient. Any version of you are wrong. You know, when a patient comes in and maybe you're talking to them about the fact that they might lose their teeth or whatever, they say, oh, that's my grandpapa had 3 sets of teeth. And you know that the person did not, but don't say you're wrong. You know, a friend of mine had a root canal, the whole thing just fell out. Well, you know that patient only had a pulpotomy and a crappy piece of temporary stuck up there, and they didn't get their treatment completed, but it doesn't matter. Don't correct the patient. Don't tell them they're wrong. Patient says something, oh, my grandpappy had 4 sets of teeth. You say, that's one for the books.
That's a good one. That's a good one. Never heard that one.
Exactly. Anything like that, but don't tell them they're wrong. So there you go. Plain and simple, 10 things that a dentist or team member should never say in front of a patient or to a patient.
Remember, we have a lot more for you. I'm Dr. Dave, Dr. Rich, but make sure you press the subscribe button so you won't, and make sure you turn on your notifications so every time we upload a new video here on the Dental Practice Fixtures, you will be the first one to see it. Thanks so much for being with us. We really appreciate it.
And we will absolutely see you soon.